Welcome to this video supporting healthcare professionals who have an interview for a clinical governance role coming up. I'll be giving you key tips to help you prepare, I'll signpost some key resources to help you, and I'll also present some generic example interview questions, so I hope you find this video useful. Firstly, it's really important that you understand the specific clinical governance role that you've applied for, key responsibilities in the role, and how it fits with the rest of the clinical governance team and the team across the service that you're working with. There's a range of roles out there. I've listed a few here, from clinical governance officer right up to a clinical governance strategic lead level. And you'll find that some of these roles are very specific to one local service. They'll be supporting a team with handling incident reports, complaints, for example. Whereas others are much more corporate level strategic leadership posts that will involve analysing key data and trends across clinical governance across the whole NHS Trust, for example, and then they might have to report to external government bodies. But all of these roles require an element of data collection, analysis of data, themes, trends, and then there's an element of reporting and then responses to that data, which will require future monitoring. So hopefully I'll go through some key tips that would be relevant to any of these types of roles. We have a range of job descriptions and job titles across the UK linked to clinical governance. So a key part of your background preparation starts with that job description. It's helpful to review the job description, go through systematically and highlight any keywords or terms. So if it's a leadership role, for example, it might include the term transformational leadership. So do you know what type of leadership that is? Now, you might not be asked that question, but you might be asked something on leadership, on what type of leadership style you use or what leadership skills you've got. So there'll be key themes that you can draw from that job description, and you can read around those themes. You might be asked a question on a national safety standard that's detailed in the job description. So look out to see if there's any national quality assurance frameworks or data protection legislation, and then just update yourself with those. Also check who you're working with. So you'll be responsible to somebody in that job description, which is usually detailed, or they'll talk about the different services that you link to and different teams or organisations, internal and external. So how does the role fit with those teams? Because you can be asked questions that relate to team working or positive collaboration and working across teams or services in your interview. Revising key terms linked to clinical governance, quality improvement, quality assurance helps, because your mind can go blank. If you're just asked a question, what is quality assurance? It's really easy to go blank. So just very simply have a think about, if I'm asked those sort of questions and how they relate to this role, how would I answer them? Reviewing, as I said, reviewing key standards, policies, frameworks. The role may be very specific to falls prevention, for example. So looking at what are the current national standards, policies, frameworks relating to that specific role. And it's also helpful to have an informal visit, or you can potentially phone recruiters if you can't arrange a visit. And that gives you further insights into the role. You can ask questions. You could ask them, what are the key priorities in the role? Is there any current challenges, for example? And if you've got any questions about how the role fits in teams, it's great to gain some further insight. So networking with people currently in the role is helpful. You can ask them about those areas too. You might want to ask them about incident reporting and how they disseminate and monitor actions, for example. What are the current processes they use in the role? So networking with people in the role is helpful. And then also reviewing employer websites. You can gain insights such as the core mission statement, their current values. You might be asked questions on those. If they talk about culture, organisational culture, for example, that's very topical currently. How would you answer a question on that? So reading around organisational culture, if it's on the website, maybe. They might have recently won an award, and you could bring that up. If it's an NHS Trust, they might have recently won an award linked to clinical governance. And it just shows that you've done a little bit of research on the role. So I've summarised some of the key terms that you need to read around, and you also need to think about the structures that align to those roles. So clinical governance, how do we embed evidence or assure robust clinical governance? Promoting quality and compliance. You're going to be looking at local national safety standards, clinical governance frameworks will be underpinning the roles, whichever role that you have. You might be asked about what quality healthcare is, how do we measure quality in the role, what is quality assurance? How do you assure quality in the role? What is quality improvement? And it's helpful to revise those overall terms and structures and tools around those terms, but also risk management, patient safety. The role that you've applied for may be linking to talking to relatives. So part of your role might be ringing relatives following complaints, or patients following complaints when they've gone home, for example. So all the terms around risk management, patient safety, incident reporting and complaints. We have national guidance on incident reporting and complaints, and I'll be signposting some key websites later. And audits and service evaluations. I know somebody that was just asked what is an audit and they couldn't answer. They knew and they did audits regularly, but when you're asked in an interview, you know, what an audit is and how it would link in their role, or how would you use audit data, they went blank. So just have a look around those areas. And then leadership, organisation, management, and it depends on the type of role that you've applied for. You might be very much in a supportive role, analysing data, to somebody that's leading a large team. But leading, organising, managing in some form will be in that job description. And then education and training, because we always learn from clinical governance data. For any role, I would suggest you look at the 7 pillars of clinical governance and become familiar with those terms and those 7 pillars. If any of you've got interviews coming up, I've got several videos on my YouTube channel that give a really simple overview of some of the key terms that might come up, such as clinical governance, risk management, clinical audit, quality improvement and clinical incidents. And I also go through the structures nationally that link to those terms. There's some good signposting for some websites, and lots of people have fed back that have had interviews that they found these really useful because they give a really simple overview of key terms. So I hope you find those useful if you do want to check them out. As I said, they're all free on my YouTube channel. If you're going for a leadership position, or your role links more to quality improvement or service evaluations, I've also got some videos to help in those key areas as well. So I hope those help. And as I said, they're all free on my YouTube channel. So with any clinical governance roles, there's going to be key standards, policies, procedures and frameworks related to clinical governance and specific to your role as well. There'll be local and national ones, and I've signposted a few key areas here. Escalation, safeguarding and health and safety policies and procedures, pathways and standards. And you don't have to know in detail, but just have a read around those frameworks and standards. We maintain a risk register and a risk assessment according to policy. Incident reporting and investigation of incidents. So we currently have a patient safety incident response framework in England, for example, the PSIRF. That might change in the future. We're watching this video in 2024, but the principle is the same. What are the national quality governance and patient safety frameworks relating to your role? We've got complaints management procedures, which will link to clear escalation procedures and specific timelines too. Data protection and the storage of data. In a clinical governance role, you will have access to sensitive data. You will be analysing sensitive data, and you might need to share data with local managers, and you have to adhere to general data protection regulation. You might have a subject access request or a freedom of information request. If you're dealing with complaints in the role, a relative might want some data about a loved one, for example, or a patient might request data. Subject access requests relate to personal information, whereas freedom of information relates to non-personal information that might be held by an organisation. And as a healthcare professional, you need to abide by professional standards linked to patient confidentiality and the storage of data too. So you might have scenario-based questions in your interview that relate to a person requesting data. So it's important to know about those regulations. And then you've got government, NHS, national service frameworks in each of the 4 nations that we need to, that the role will link to. The Care Quality Commission regulations as well are worth looking at for service providers and managers. And on the CQC website, they have assessment frameworks and evidence categories that you can review. They're readily available. And then any procedures or standards linked to the specific field and service. So for example, if you're a governance infection control governance lead, or a falls prevention lead, or the role links to mental health, to have a look around any key national standards and frameworks in those areas. So I've signposted some key websites and resources as well. So we've got the government NHS websites. So for example, the current incident reporting systems and management and the patient safety incident response framework are on those government NHS websites. NHS quality priorities will be on employer and government websites. The Healthcare Quality Improvement Partnership website's excellent. They highlight some up-to-date reports. They have a bank of resources and related links to audits, national patient outcome data, for example, that's interesting to read. Care Quality Commission, CQC website, that's the regulation for service providers and managers. And as I said, they've got an assessment framework and evidence categories. Many employers have quality improvement hubs where they've got quality improvement frameworks, models and tools if your role links to quality improvement. And the Institute for Healthcare Improvement website as well has got a range of models, tools, methods and resources. And in a few years there might be different websites, but the principle is do a bit of groundwork before your interview and have a look at some key websites that are available. So moving to preparing for potential interview questions, there's always going to be some generic type interview questions. So have a think about some of these questions and how you would answer them. Why have you applied for this clinical governance role? Or they might reword it and say, what do you know about this clinical governance role? Or what do you think the main responsibilities of this role are? The key to this sort of question is they really want to know that you understand the key responsibilities in the role, that you're the right person. And so knowing what the key outputs of the role are, the objectives in the role, it's really important. And doing the prep that I mentioned earlier, going through the job description will really help you answer that sort of question. What will you find most challenging about this role? Or if you're offered this role, what do you envisage being the most challenging aspect? What do you think you'll need the most support with? And again, they want to know that you're going to ask for support if you need it, that you can manage your learning needs, you can address any gaps in your knowledge. But again, looking at that you've got insight into that role. You know, you won't have worked in a clinical governance role probably when you're applying, but it's drawing on that past experience. You know, you've probably written reports, you might have done audits before, and talking through how you would plan to overcome those challenges. Which is through education and seeking support from experts. They might ask you questions about the service or the organisation. Why did you apply to this specific trust and employer? And again, I signposted earlier that you need to look at the mission statement, the values of the trust, look at what's been happening locally, the newsletters. Have you looked at their website? And you might get asked questions about an aspect of those values. So a lot of trusts at the moment are talking about organisational culture, for example, and a positive culture. Also, what key skills are required in this role? That's a typical question. What key skills or values do you have that would link for this role, or that would link to this role? And you can draw down on your transferable skills and link to you know, managing sensitive information, your communication skills, talking to patients and relatives about complaints, or setting up training, learning from incidents. So you might have set up training programs before. So you're going to draw on those past transferable skills that you have that link to that role. And that's why it's important to reflect on your past experiences and highlighting those key areas that you've developed in that link to this role. Leadership skills, quality improvement. Why should we offer you this role above other candidates? It's really about selling yourself and thinking about how you'd answer a question like that to highlight those personal achievements and qualities. So don't hold back on these types of questions. Some other generic type questions you might be asked linked to managing stress, workload, effectively meeting timelines, which is a big part of a clinical governance role, managing staff performance or teamwork, or conflict in a team, or conflict between patients and relatives. And I've given some examples here. Not these questions might not come up, but there's a few examples here. So how do you manage your work-life balance? What strategies do you use to manage stress at work? What strategies do you use to meet deadlines at work? How would you support a staff member in your team who says they're struggling? So with that sort of question, you're going to have to establish what they're struggling with. Is it something out of work? Are they burnt out? And it's about fact finding initially. So you're establishing what the issue is, and then you can put strategies in place to support an individual. Do they need time off? Do they need referring to occupational health, or do they require more training and education or supernumerary time if they're new in their role? And this sort of question's more for a team leader type role or someone senior in clinical governance. Another question, you overhear two members of staff shouting at each other in the clinical area, what would you advise? And you would, if you're managing these two people, you would need to again find out exactly what the situation is. Don't take sides, listen to each person's point of view, take these conversations away from patients and other staff in a quiet room, but adhering to HR policy, seeking advice if needed, but suggesting mediation potentially. Most conflicts can be resolved locally through open, clear professional communication, but making sure that staff don't have to be friends, but you expect them to act in a professional manner and to develop a professional relationship. Tell me about a time when you positively influence care through teamwork, or how you would plan to promote positive teamwork or collaborative team working across a team, again for a senior role. So I'm not going to go through all the answers, but it's helpful to think about these generic type questions before your interview and have some good case examples where you've promoted collaboration in your current role, for example. If you are managing teams as part of your role, I have two helpful videos free on my YouTube channel if you want to look into that aspect a little bit more. How to deal with conflict and incivility for nurses, and then teamwork in nursing. The how to deal with conflict and incivility actually is also helpful when you're dealing with patients, relatives, who might be quite unhappy with the situation as well. So the strategies in there are quite helpful for those sort of scenario based questions, and they're all free on my channel. You might be asked some questions linked to quality healthcare in any role. So I've just put a few examples. How do we measure quality healthcare? What is clinical governance? How does quality assurance link to your role, or what is quality assurance in healthcare? How do we assure a safe standard of care across our services? Or they might say, what would be your top 2 priorities to assure a safe standard of care in the role? So talk me through what risk management is, or it could be a question linked to the 7 pillars of clinical governance. What's the difference between audit and service evaluation? How do we evaluate the standard of care across our hospital or clinical services? And I've got a quality improvement and leadership playlist on my YouTube channel that might help if you're in a more senior position. Now, none of these questions might come up, but you might be asked a question on one of these types of topics. So as I said, it's reading around these sort of key areas, because you never know what sort of questions are going to come up, but that you're prepared to answer any of these types of questions. And then you might have questions linked to support, training or education. It depends on the type of role that you've got. But how do you keep yourself up to date is a classic question, with research or the latest evidence or with the latest national frameworks, because part of your role is to know about those frameworks and the latest evidence. Give an example where you've recently provided evidence-based care. Give an example where you supported another member of staff and describe how this impacted them, or where you educated a patient or a staff member. And again, this might be because the role specifically links to having to provide responses to clinical governance reports and linking to staff education. It depends on your role. But also part of your learning is important. So how would you ensure the learning needs of your team are met for a senior role, but for sort of more early career governance roles, it would be looking more at your own development, training and education. How would you promote compliance with statutory mandatory training, or what strategies would you implement to retain staff in your team for more of a senior role? So these are some generic type questions that might come up. If you're having a value-based interview, you might be asked to talk through a previous case example. So it's helpful to prepare an example that best shows off those transferable skills and how you positively impacted care. So think about an example where you can demonstrate evidence-based practice or where you've implemented the latest research. Think about an example where you've identified a risk and managed it effectively. Think about where you've improved an aspect of care through your leadership. They may ask you about different types of leadership styles, but they might actually want an example of where you have used your leadership skills. Think of an example where you've led or been involved in quality improvement. And ideally, if you've been linked to a quality improvement project, that would be really good to talk through. A positive example of teamwork and collaboration, an example where you've educated others or positively impacted learning and development, and then maybe one looking at dealing with a challenging situation, something that you've learned from linked to that challenging situation. So to have, you might have one example that links to lots of those different areas, which is fantastic. But think about, if I was asked about this, to give an example, which example am I going to use? And also you might be able to build in an example into any sort of question that you're asked. You can say that I've actually dealt with this recently, and bring that example in to show those transferable skills as well. If you are going for a senior position, you might have a presentation to do, you might have to do group work, and you might want to think about what sort of questions you would ask at the end of an interview. I've got videos on all of those sort of topic areas, and I've got a video on a band 6 or 7 nursing interviews for any band 6, 7 interview. But some of those videos might help if you are doing a presentation as part of your nursing interview. So do check them out. So you're probably going to have a few scenario-based questions, or what would you do if this happened? And these types of questions will link to the job description, the type of clinical governance role that you've got, and your role responsibilities. But I've just put a few down here that might help you. Think about if you are linking to clinical instant investigation and part of your role is to phone relatives, or you have to link to relatives in any way. Example question, you're following up on a clinical instant investigation and you've just phoned the patient's relative when you realise they have a hearing impairment. What would you do? Or the patient might have a hearing impairment. Another example, the person may become hostile or verbally abusive on the phone. What would you do? So think about that. If part of your role is to telephone people at home, patients, relatives, what are you going to do if this situation happened? Another question, you've received data from clinical instance, or it could be from a patient complaint or audit. What would your plan of action be? So that data, they might state there's an increase in falls, there's been an increase in infections, or it could be the outcome of a handy hygiene audit, which is poor, which shows poor hand washing in the area. So it depends on the type of role you've got, but you've got this data. What would your plan of action be? So think about how you'd answer those types of questions. Another typical question, how would you plan a coordinated response to this data? How would you effectively share this information and monitor the situation? So it's all aspects that should be in your job description, and think about how you would answer these questions. Another typical question, what national reporting timelines must you adhere to relating to X, Y, Z? So again, it's all that preparation I mentioned earlier of looking at those national frameworks, looking at the complaints procedures, instant reporting. What are the timelines linked to those roles and to those areas? It could link to a local or a national instant reporting procedure, or a patient's complaint procedure, for example. Another question, if you're linking to sort of patients and complaints, you might receive a subject access request or a freedom of information request. What would you do? So you need to know what your responsibility is. you need to know about the policies relating to these requests and procedures. You don't need to know the exact details, but key aspects of those standards would help you. So looking at timelines, what would your role be in relation to this, and when do what's the procedure involved? Lots of clinical governance roles will link to CQC visits because you are key to analysing trends and data, and you might have requests for data. So I've got a scenario-based question here. The CQC are visiting the NHS Hospital Trust in 2 days' time. How would you prepare and plan for this event? This will depend on your role responsibilities, but you need to think about using a systematic approach as they might request data from you. I signposted earlier CQC requirements, so assessment frameworks and evidence categories earlier. That would help answer your question there. Another question, you find that sensitive data has been corrupted, what do you do? And this links to reporting, escalating, if there's been a breach in confidentiality, for example, but adhering to those procedures and policies. Another question might give you a scenario where something's happened. How would you develop plans to mitigate risk? How would you assure robust clinical governance in this situation? So a scenario linked to that specific role where something's happened or there's data that's come out, and how would you mitigate that risk and plan to prevent future risk, future clinical incidents or clinical events happening? That's a typical question, especially if you're dealing with incident reports. How would you plan to embed quality governance and promote quality compliance across a service? And again, that's a senior type role and question, and working across teams, linking to national structures. None of those questions might come up, but these sort of types of questions will get you to think about that role and the standards expected. So all the preparation I suggested earlier should help with scenario-based questions. I mentioned earlier that you might have a presentation as part of the role, and I have a video to help people prepare for presentations and interviews, but you also might have paper-based exercises, and you might be given those for senior roles, for example. So you might have a series of charts or tables of data or some numerical data, and you have to analyse and theme them into a report. So, for example, analyse the following data that you're given into a short summary report. So think about how you would structure such a report, and linking to clinical governance leads will help you. I mean, for any interviews, they should really let you know if they're going to do group exercises or paper-based exercises or a presentation before an interview, but it's helpful to have a look at some clinical governance reports, and usually it's quite a short piece that they would want. And it's about being very factual. So think of it as if you were writing a clinical incident report, I would say is helpful. They don't want lots of descriptive, flowery language. It's about looking at the data and analysing it specifically, factually. Or analyse the following data and report on any trends and themes that you see. So you might have to read something and then say that verbally, report back verbally. And so that's why networking with clinical governance needs might help you, or current leads in the area that you work. So managers would have clinical governance reports, for example. Ward managers or community-based managers would have those reports. Or you might have data that's already been analysed, and they might say respond to analysed data, or a clinical governance summary, and identify 4 recommendations from that report. Again, that would probably be for more senior level roles, strategic level roles, but think about how you would respond to analysed data and what your 4 recommendations would be. So looking at developing action plans in response to data, and objectives, aims, outcomes, and looking at previous reports would help you with those paper-based exercises. So good luck with all your interviews. If you've got any questions at all, don't forget to put them in the YouTube comments and I can answer them for you. I'm an author of 2 books as well, so do check out my books, How to Thrive as a Newly Registered Nurse and How to Prepare for Interviews and Develop Your Career as a Nurse or Midwife, and that's from newly registered nurses going right up to band 8. So there's lots of information in there and lots of tips for interviews. If you prefer to ask me questions privately, you can DM me on Twitter, but I'm very happy to answer questions in the YouTube comments if you've got any. And wish you all the best with your interviews.